it's hard when people that are involved in care kind of beat around the bush and don't actually tell you what's going on. I think it's important to be honest and factual, because being too sensitive and being too vague means that people are left not really knowing, and I think there is no point in having confusion in an emotional situation.
But in my profession, I would want to talk about it with the residents I look after and with their families, because it's a stress time for the families without needing to ask at that crucial moment. And talking about it is at the start of a life-limiting illness. It's not 3 days before somebody passing away. It's right at the start to get everything put in place so that you make it right for that one person.
I suppose there's certain things within the care that you're given when you're dying that people might not necessarily understand. So it's for staff and people to understand what all the different terminology is. So when someone says someone's terminally ill, do people actually understand what that means? If people are talking about palliative care, do people actually understand what that means? And that's for all levels really, so older people down through to younger children as well. I think they need to know what these words mean, so that when people around them are talking about it, they can understand it.
I think it's important for a number of reasons. First of all, to address the individual concerns, fears and uncertainties, and to address in some way the uncertainties and fears of that person's sort of nearest and dearest, so their family and friends and acquaintances and so on.
I don't know, because I'm hoping that I'm fortunate and I live a long life, and whoever is part of my life at the time is there for me to talk to. I think it's really useful to have those conversations before we get there naturally or unnaturally, because a lot of people don't quite understand what people's wishes are, or they expect that they know, or they really just don't understand why the person wants something. They just blindly go along with what their requests are. So I think conversations need to happen, because it's something that happens to all of us, and we all have different ideas and beliefs of what happens afterwards. But really having those conversations about what you want as an individual and what you want for those close to you need to just be spoken about throughout your life. Like I said, it's something that will happen to all of us.
I think it's really important. So perhaps not comfortable, because sometimes you immediately think of people that you've lost, people who've died. And so that makes it feel emotive. But without being able to reach out to people and say, it is okay, it's part of life.
Yeah, and it's not age-related neither. I find that there are some people who have come to terms with that their life is ending, and they're quite happy to talk about it. They tend to prefer to do it from an autobiographical point of view. They like to tell me the things they've done, the things they're proud of, sometimes the things they regret. But then there are other people who find it a very alien concept. They go into denial, or they don't go into denial, but they get very angry. We see people who complain an awful lot, and it tends to be them just trying to control anything because death is so out of their control. So I find that it's not age-related, it's not gender-specific, and it's not illness-specific neither. It can be somebody who's been dying for a very long time, who hasn't come to terms with it, and you can have somebody who's very quickly been given 3 months to live, who comes to terms with it very quickly. It tends to be more about what stage of life they're at and what regrets they have.
Yeah, I think it's really important, especially from a nursing perspective, due to the fact working in quite an acute setting, so intensive care, dying was a regular part of our job, unfortunately. And it was treating that person with respect and dignity, but also the family were the most important in that aspect. So I think it's really important that you involve not just the patient, but definitely the family members as well. So,
as a professional, if I was dealing with a patient, then the people I'd want to talk to, obviously, is the patient themselves. You have to take into consideration what patients actually wish. Some patients don't want to talk about difficult conversations, but also we need to make them understand and help them to deal with the situation that they find themselves in. I think sometimes patients themselves will ask, but if they don't, then it's something that we need to not wait for that opportunity. If this is the situation we're in, it's something we need to broach as professionals.
It's not a nice thing to talk about as a doctor or in any other role. It's a very individual thing, and it's just to say that there's a lot of support through the process, although that might not feel like a big thing when you're actually going through it. I wouldn't imagine, but if it were me or one of my family dying, just that it's an individual at the end of the stethoscope, and that the person needs to be treated as such and with dignity and care, and to address all of the needs, including anxiety, pain and fear.
I think it's important that we're clear as a team what the care of the patient, where we're aiming, what the intentions are going to be. And that's through documentation, conversations, making sure everybody's aware that if the patient is dying and we're looking towards the last few days, that we're actually tailoring the care towards that, and everybody is aware of that. So there's no miscommunication, and we're all providing the appropriate care.
I remember very gratefully a consultant sitting down with us and starting those conversations about poor prognosis. It made it so much easier to have that third person involved in those conversations at that point, because for us as a family, our emotions were so heightened, it was incredibly difficult to start talking about death when we all knew that death was only a matter of days away. I think doctors and nurses are instrumental in starting those conversations. All too often we leave it too late, and it is incredibly hard to talk to people that you love and you know you are going to lose at that time in their life. But having that person there that starts that conversation takes some of the emotion out of it and helps progress those conversations forward, particularly at a time when they need to be, some of the issues need to be brought out quickly, such as, does a person want to die in hospital, or would they like to get home to be back home with their loved ones? So we have, as professionals, a really important role to play in that.